think we're all assembled, Secretary, so anytime you want to kick us off.
Oh, right. That's right. I'm not sorry. Good morning, everybody. Thank you so much for your willingness to consider working around COVID-19. And I have been leaning in on Louis and some of the connectors' expertise. And let me just tee this up a little bit. As you know, we are, so I have both my board chair hat on and probably my commander hat on in terms of what we have a proposal for you. It's very clear we are in sort of the beginning of April is going to be a tough month. It's pretty much when we're going to see the surge on our hospitals and the capacity. As you know, we've tried to increase testing, and it's extraordinary to me to believe that on February 28th, we had no capacity to test anyone for COVID-19 in Massachusetts. And we're now testing, it's just under 50,000 people to date. And we need to obviously keep expanding that. We've gone strong on social isolation, and I can see that Dr. Chernow has lost his razor. So that's his form of social distancing, apparently. But truly, really extending the governor's emergency services order through the month of April to try to bend the trend of COVID-19 exposure in Massachusetts, right? The more we can bend the trend, the better the likelihood of not overstressing our hospital systems. Third is creating backdoor for hospital in terms of the medical field unit out at DCU. Partners, I think, agreed today to work with the city and the state on something at the Boston Convention Center. So obviously trying to create release valve for our hospital systems. And the other is to really engage in statewide tracing of individuals. Half of our state has no infrastructure or minimal infrastructure to really engage in that contact tracing of individuals who have tested positive and or who have been exposed in order to isolate and quarantine people until it's safe for them to be asymptomatic. And that's really what we're here before you today. And it does, when I say stretch, while this may be outside the main responsibility of the connector, it is really drawing on the expertise of the connector to help create the platform for us to contract with an organization that all of you would know their name of, to really create this statewide process of contact tracing across the Commonwealth, which we can stand up very quickly. How's that for my opening act, Louis?
Sounds good. If it's okay, I'll just go right into the deck with a few preliminary words. I do want to say good morning and thanks to each of you for your flexibility in convening an emergency session. I want to simply express my hope that each of you and your loved ones stay healthy and safe. And not as exchange director, but simply as a resident of Massachusetts, I want to thank you, Secretary Sutters, for your leadership of the State COVID Command Center. It's a nonstop effort to face the myriad issues posed by COVID-19 in our community, and we give you our sincere thanks. These are circumstances unlike any in our life, and I also want to express gratitude in our health. We apply them for all of us. First, this day that time is precious. Days now have taken on enormous importance as we mobilize to contain the spread of COVID-19, supply our healthcare providers, and start to establish those mechanisms that allow it. So today I'm asking the board to authorize the connector to flexibly undertake such as the COVID-19 Command Center may determine necessary to support their efforts consistent with our overall mission and capabilities. So Drew, if I could ask you next slide. So the purpose of this presentation is to brief the board and obtain your vote authorizing the Health Connector to undertake in support of the pandemic emergency. In light of the emergency, the Health Connectors must play an important role. And given the Health Connector's expertise in IT contracting, system integration, contact procurement, and general project and contract management, the Health Connector can provide needed services and activities while continuing to carry out its core exchange responsibilities and functions. Next slide, Drew. Today's board discussion relates to the Health Connector's support for state command center efforts, but is not a review of the contact tracing approaches. Multiple means of support are under consideration and underway. The Massachusetts Department of Public Health will be the lead agency for identifying epidemiologic system interfaces and tracing protocols. Staff working for partner organizations will be responsible for implementing these protocols. And the Health Connector is positioned to support some essential needs that would underlie any attempt to create large-scale automated contact tracing. But the Connector Authority lacks standing to comment upon the design and protocols of tracing efforts per se. Next slide, please. I think I'm sorry, I am the one who's skipping slides. Let me find out what I did. Where are we? What page are, I can't see the page number that you're on, Drew. I need us to.
Page number 3.
Okay.
You're on 3.
Okay. Okay, we need to go to the next slide.
There you go.
Okay. So just quick background. On March 10th, these are facts we all know, Governor Baker declared a state of emergency and quickly established a COVID-19 command center headed by our board chair, Mary Lou Sutters, from which the Commonwealth response is being coordinated. There are some basic facts we lay out regarding how COVID-19 spreads and the risk it poses to individuals who test positive or their contacts. It is, of course, really affecting the health and welfare of residents, but also the whole healthcare system, including providers of healthcare services and the institutions that pay for it. Among them, the health insurance issuers that sell coverage through the connector and throughout the merged market. Next slide. We know from evidence elsewhere that multiple coordinated approaches are most effective at containing the outbreak. We're well in the middle of social distancing. Today, we're addressing a piece known as contact tracing that would establish a technique for identifying those infected with the disease and those with whom they have had contact and monitoring those individuals to ensure they are tested immediately and otherwise given appropriate care. Currently in Massachusetts, as the Secretary said, contact tracing occurs through the local boards of health, who coordinate through DPH. There's a central system of record known as MAVEN, in which disease tracking is tracked in the Commonwealth. And the command center, in conjunction with DPH, has determined that Massachusetts must immediately and significantly expand its contact tracing capacity and is approaching multiple millions of now. So, next slide, Drew. And so, to be specific about the role of the Health Connector, given some of our background and experience, we're looking at 3 categories of service support at this time. First is stand up a call center with requisite systems and technologies, including contact relationship management, security mechanisms, cloud mechanisms, mobile calling mechanisms, a suite of technologies that are going to be necessary to enable a virtual call center, because we won't be asking people to come to a central location to place calls. Secondly, additional qualified contact tracing personnel. And thirdly, general project management. The current expectation is that the Health Connector will work with outside vendors to provide call center services, and that these will exchange data. The integration may be pretty, how would I say, basic. So the integration word should be taken with a grain of salt. It may be file transfers, it may be, whatever it takes, but we need to keep in sync with DPH's Maven case tracking system. And I think the other elements we've already mentioned. So next slide, Drew. The command center is working closely with the Executive Office of Administration and Finance to arrange the funding for these activities.
Why don't you just pause there, Louis? So I want the board to know that the funding will come from probably the CARES Act. What we need is the connector to sort of, my words, jumpstart this with the funds flowing back from the CARES Act or a supplemental appropriation from the Commonwealth. This is not asking the connector out of its budget to pay for this in the long run. It's a jump start for us to get started.
Essentially, it's a timing issue.
Yeah. Hello, Nancy Turnbull.
Hello, how are you?
Are you in some beautiful place?
I have a virtual screensaver that is a photo of Denmark, where my daughter was before she had to come home.
Oh.
Abroad, but
sorry. All right, sorry. Didn't mean to.
That's all right. It's nice to see you too, Secretary.
Okay. Mark,
you may be the only one who thinks that.
No, I think I speak for everyone that we are in awe of your leadership, how hard you and your colleagues are working, and the extraordinary responsibility you have at the moment.
Oh, thank you, Nancy. Thanks.
Here.
Louis, what I was going to say is essentially it's a timing issue. That's what I'm hearing Secretary Sutter say.
Yeah. Yes.
Okay.
And so, yes, so I'll go on to, I think the bottom line of this, which is with regard to our mission match for this, the whole merged market is affected by the pandemic, as is our sister agency, Mass Health, with whom the connector shares major systems, and we share overall responsibility for a second population. And so it very much affects our members and related members. And so this is very much in Connector's core interests as well. So next slide, please. So just a note on actions to date and the board need going forward. I've asked for opinion of General Counsel, who has determined that the board may authorize the Health Connector to undertake these activities as necessary for the maintenance of Massachusetts healthcare system, including the Health Connector itself, posted under Mass Health, under Mass General Laws, Chapter 176Q, Sections 2E and 3M. And if anyone has questions about that, I'm going to refer you to Andrew Egan. We have been laying groundwork on an emergency basis to support new call center capabilities and contracting vehicles for necessary personnel, as well as project support staffing. Next slide. So it's proceeding at a pace that is unprecedented. You know, the demands are really hour to hour, not day to day. And of course, our world is very highly fluid at the moment. Each day brings a deeper awareness of the situation we're in, necessary supports, activities across the community, related functions relating to testing and testing sites, and every manner of that needs to come together in support of an overall community response through the command center. We will keep you regularly updated on our court activities, as well as matters relating to the change functions that will continue uninterrupted. And in line with what the secretary said earlier, we were tracking activities in separate budgets and accounts from routine exchange activities. Next slide, please. And so the connector is asking for a temporary refinement in section 6.2 of the Health Connector's bylaws in order to maximize our responsiveness in the current emergency. Section 6.2 of the bylaws currently limits my ability to execute contracts that are worth more than $15,000 by requiring 5 days notice, or if more than $250,000 requiring formal board vote. The Health Connector executive team, which I own entire accountability for, is asking instead that upon information of need by our board chair, who also sits as the State Command Center chair, director, and approval as to budget from the Secretary of Administration and Finance or his designee, that contracts be allowed to proceed. Next slide. We've mentioned before the areas in which we expect contracts to be rapidly assembling. This is certainly in relation to personnel, to infrastructure, to integration with other systems, project management support, and such interagency service agreements as are necessary between Connector, Department of Public Health, Executive Office of Human Services, or others. Next slide. Throughout, we will be maintaining commitment to our core mission. We will fully discharge our accountabilities to our membership as a state-based exchange. We do not see competition or jeopardy to that role. We need to think about prioritization with relation to the customer experience training effort, but at this time, that proceeds at pace as well for July delivery. In recent weeks, beyond anything we've talked about to this point, the Health Connector has executed a variety of actions relating to coverage through the connector, including extending the COVID special enrollment period, as well as creating an emergency funding mechanism to avoid terminating or denying medical services to residents that were going through delinquency procedures at the end of March. Healthcare Connector staff continue to advise the board of all of these activities that are not related to the tracing supports. Next slide, please. And then the final slide. Drew, if we can go to the next slide there.
Yeah.
So before we, yeah.
I have a question right before the vote, if I can. So first of all, I want to echo all the comments in gratitude for all the work that you're doing, Secretary Sutters. It's incredibly important to be on top of this for health and economic reasons. I can't emphasize that enough. I want to make sure that what we're approving is flexible enough that should needs change in particular ways, that you will have some flexibility to respond to what might be an evolving situation. My particular concern is that while I very much understand the importance of doing the contact tracing, I also think at some point we might want to do something that I would call high contact tracing, where we're testing people that aren't necessarily contacts, but people that are in high contact situations, ranging from healthcare workers, which is obvious, but also, for example, to people that might be our first responders or asymptomatic people that otherwise might be in touch with a lot of people that could spread it. And I want to make sure that what we're approving gives you enough flexibility to allow the system to respond in that way if it's deemed that the criteria change.
Thank you for that. So we have continued to modify who can be tested in terms of both. So as you probably may or may not know, we've actually rolled out now a mobile testing program for individuals who are in nursing homes. It's interesting, like you say, you think it's going to be something easy to do, right? And then you find all these regulatory issues that come up. We rolled it out, and in nursing homes, we actually test everyone, symptomatic and asymptomatic. And I'm sorry?
I just asked if you were including the staff. I know that was a little bit out of order.
Yes, including the staff. The more we can, it's not in here, but we will be announcing one of those, we're going to be the test site for one of the rapid testing programs. And that is going to be for asymptomatic or healthcare workers and other first responders and the like, as a way to minimize spread. I mean, honestly, if we had the capacity to test everybody, we just don't have that. So we are prioritizing particularly individuals who have the highest contact potentially with individuals who could be symptomatic, from healthcare workers, first responders, nursing homes, funeral directors, believe it or not, EMS, and it goes down. We have like a whole prioritization list, which, as you can imagine, if you're not high on the prioritization list, doesn't make me very popular. But it's fair and equitable. And that's how we're rolling it out, Michael.
Secretary, when you say rapid testing,
we have flexibility to help you as you do that. That was my only question.
No, I appreciate that. I believe this does, and we could rapidly turn around. Nimbleness is very important during this period. And I have discovered parts of government that are nimble and parts of government that are not so nimble. I'm keeping a list for when this is over.
Mark,
I was going to ask, when you were talking about rapid testing, are you taking advantage of the Abbott Laboratories test that was just created? Is that
yes?
What you're referencing?
Yes, we're one of the three states that, I think it's 3, it might be 5, but I think it's 3 states that sort of leapt at it, and then you complete the details. I mean, I would honestly tell all of you that as someone who likes to be organized and very detailed, I've been making more decisions based on incomplete, imperfect data in order to secure things such as the rapid testing. We worked with partners on securing one of the 3 Battelle N95 disinfectant machines, which should go live this weekend. And I honestly, made a commitment for the state, and I thought, oh, please let this not be a scam. And it's not at all. But when you just like in the moment are these, because of a whole lot of other factors, and I'm sure you've heard the governor be clear, like we have lost so much in the supply chain when we've announced things, and all of a sudden you find it's been scooped by the federal government. So
sounds like you're living the life of an entrepreneur inside a big system.
Blech.
When you're dealing with incomplete, when you're dealing with incomplete information and going with intuition, that is the life of an entrepreneur. It's challenging.
Yeah, well,
I applaud you for that.
It's pretty scary. Anyway, so yes, I do believe if this is something that's agreeable to the board, I think it helps us enormously in getting this set up.
Other questions or discussion elements? And I do have to admit, I just got Mark Gagne's chat message that I was fading in and out. So my staff can lash me afterwards because it's what I'm always ragging on them about.
Lewis, one way to manage that is you'll notice I have earplugs in. That does help. For those that don't have earplugs in, it does help as opposed to trying to talk through your computer. And I only know this because I'm pretty much doing Zoom calls all day long, every day with our clients. And it's the only thing I've found that cuts out the kind of fading in and out. So just as a tip.
It helps until we all go deaf in about 2 years from having your.
Probably.
Good point, Nancy.
Anyway, so this is the vote that's before us. So if there's not any further discussion, I would ask for a vote. Is there a motion?
So moved.
So moved.
Is there a second?
Second.
Any further discussion? Hello, Matt Vino.
Hello, Secretary.
Any further discussion? All those in favor? Oh, do we have to do this by individual voices because we're virtual?
I think so. I think we have to do a roll
All right.
call.
A roll call? Thank you. Okay, so Mark?
Aye.
Aye. Matt?
Aye.
Nancy?
Aye.
Michael?
Aye.
Mary Lou's and I. Who else is on the call? Rena? Aye. Is Dimitri?
Aye.
I can't see people. ANF?
I'm go.
Yep, this is Cassandra Roeder from ANF. Aye.
Thank you, Cassandra. Did I miss anybody?
We've got Lou from,
Bayruth from 11.
Oh, Bayruth. Bayruth. Hi. Hey,
Hi.
Bayruth, thanks for all the hard work on 1199 with us.
Thank you so much thank you so much for everything you are doing.
Yeah. All right. All right. Anybody else?
Secretary, this is Gary.
Yep.
Aye.
Gary. Thank you, Gary. So, all right.
and Lou Massinanti is on.
Lou, thank you. I don't have the list of board members in front of me, so I'm like, thank you, Lou. You good?
Yep, Lou Malzahn agrees.
That aye? Great.
Aye.
All right. Thank you, Lou. All right, Louis. Thank you,
Thank you.
everybody. I think that's a unanimous vote. Do we have any other further business before the board?
Not for this meeting on staff's part.
All right. Well, thank you, everybody, for what you do. I appreciate all the support